Welcome to Devine Inspired Care. So glad you could join us again. Ever wondered what appendicitis is and how to identify its symptoms? Appendicitis is an inflammation of the appendix, a small tube-shaped pouch attached to the large intestine. The term itself is a fusion of appendix and itis, the latter indicating inflammation. It's a common condition, but its potential for rapid escalation makes it a serious medical concern. The typical culprit: an obstruction, often a hard stone-like formation made up of fecal matter and minerals, known as an appendicolith. In some cases, the cause could be a malignancy, or even unknown factors. This blockage traps bacteria inside the appendix, leading to inflammation and swelling. If left untreated, appendicitis can escalate into a full-blown medical emergency. This is why understanding the condition is so important. Recognizing appendicitis early on is crucial, and it all starts with understanding this medical condition. Have you ever asked yourself what causes appendicitis? Well, let's delve into that. The primary culprit is often an appendicolith. This is a fancy term for a stone-like formation made up of hard fecal matter and minerals. This little nuisance forms a blockage at the opening of the appendix. Similarly, the blockage caused by the appendicolith traps bacteria inside the appendix. This leads to a bacterial party of sorts, causing the appendix to become inflamed and swollen. In some cases, the cause might be a malignancy, essentially a cancerous growth that obstructs the appendix. However, it's important to note that this is a less common cause, and then there are cases where the cause of appendicitis remains unknown. Despite our vast medical knowledge, certain mysteries still persist. Understanding the root cause of appendicitis provides us with a clear picture of how this condition evolves. And in this case, the image is the critical importance of early detection and treatment. So to wrap it up, whether it's an unruly appendicolith, a less common malignancy, or an elusive unknown factor causing this inflammation, quick action is key. Knowing the cause helps us better understand why it's so important to recognize and respond to this condition quickly. You might be wondering, who is at risk for appendicitis? Well, appendicitis doesn't play favorites. It can affect anyone, at any age. However, certain trends have been observed over the years. Most commonly, appendicitis strikes individuals around the age of 20, although it's not exclusive to this age group. It's a condition that doesn't discriminate between the young and the old. But if you're in your 20s, it might be a good idea to be extra vigilant about any unusual abdominal discomfort. Interestingly, there's a slight tilt towards males when it comes to the incidence of appendicitis. So, gentlemen, you might want to take note. However, it's important to remember that females are not off the hook either. Knowing these trends can prove to be beneficial. It can prompt you to pay closer attention to your body, especially if you fall into these risk groups. Awareness of the risk factors contributes to early detection and treatment. What are the signs and symptoms of appendicitis you should be alert to? This is a question that can save lives. Let's dive deeper into understanding these signals so you can be better prepared. A hallmark of appendicitis is the sudden onset of symptoms, often within a span of 24 hours. The story usually begins with a vague, generalized abdominal pain, particularly around the belly button area. This type of pain, known as visceral pain, is tricky to pinpoint and may last for about 4 to 6 hours. As the condition advances, the pain matures and becomes more focused, making a journey to the right lower quadrant of your abdomen. This transition from a general discomfort to a more localized pain is a distinctive feature of appendicitis. The right lower quadrant, especially a point known as McBurney's point, is the common site for appendicitis-related pain. This specific location of pain is a critical clue in diagnosing the condition. So if you're experiencing a pain that seems to migrate from the belly button area towards the lower right section of your abdomen, it's time to take note. There are supporting cast of symptoms that can help us identify it. These may include anorexia or loss of appetite, often accompanying the initial abdominal pain. Nausea and vomiting typically follow the onset of abdominal pain. These are secondary indicators of the condition. You may also experience fever and chills, signifying inflammation and potentially an appendix at risk of rupturing. Diarrhea, though less common, affects about 10 to 20% of patients. A general feeling of unwellness or malaise can also be a part of the picture. Lastly, an inflamed appendix can irritate the bladder, causing urinary frequency and urgency. While these symptoms may not always be present, they are worth watching out for. Recognizing these symptoms can be your first line of defense against appendicitis. So stay vigilant, stay informed, and always remember, when it comes to health, knowledge is power. Besides abdominal pain, what other symptoms might indicate appendicitis? Let's delve into the associated symptoms that can accompany this condition. First on our list is anorexia, or loss of appetite. This often accompanies the initial abdominal pain, serving as a secondary signpost to the onset of appendicitis. If meals suddenly seem less appealing, and you're also experiencing discomfort in your abdomen, it might be time to seek medical advice. Next up, we have nausea and vomiting. These symptoms typically follow the onset of abdominal pain, playing a supporting role in the appendicitis symptom ensemble. It's worth noting that these symptoms can be associated with many other conditions, but when they co-occur with localized abdominal pain, they lend weight to a possible appendicitis diagnosis. Fever and chills are another pair of symptoms to watch out for. These are indicative of inflammation in the body, potentially signaling an appendix at risk of rupturing. If you're experiencing a fever and chills alongside abdominal pain, this could be a red flag. Diarrhea, though less common, affects about 10 to 20% of patients with appendicitis. If you're experiencing unusual bowel movements in tandem with other symptoms we've mentioned, this could be another piece of the appendicitis puzzle. Malaise, or a general feeling of being unwell, is also associated with appendicitis. It's a more nebulous symptom, but it's worth paying attention to, especially if it's coupled with more specific symptoms like localized abdominal pain. Lastly, we have urinary frequency and urgency. This can occur because the inflamed appendix is irritating the bladder, leading to these urinary symptoms. If you're finding yourself needing to urinate more frequently or urgently, and you're also experiencing other symptoms we've discussed, it might be time to consult a healthcare professional. Being aware of these associated symptoms is another crucial step towards early detection and treatment. By understanding the full range of symptoms that can accompany appendicitis, you're better equipped to recognize this condition early on and seek the necessary help. Remember, when it comes to your health, knowledge is truly power. Why is it so important to recognize the symptoms of appendicitis early? That's a question that arises often, and the answer is straightforward. Early detection can be a lifesaver. Appendicitis is no small matter. It's a condition that can swiftly escalate if not addressed promptly. This is because the inflammation of the appendix, if left untreated, can lead to the appendix rupturing, a dangerous and potentially life-threatening situation. When the appendix ruptures, it releases harmful bacteria into the abdomen, leading to severe infections. These infections are not only painful, but can also be incredibly difficult to treat. Once these symptoms are identified, the next step is to seek immediate medical attention. Remember, appendicitis is treatable, but only if diagnosed and intervened upon quickly. The sooner you reach out for medical help, the better the chances are of avoiding serious outcomes like appendix rupture and severe infections. So, the importance of prompt action when dealing with appendicitis cannot be overstated. It's not just about alleviating pain or discomfort, it's about preventing a medical emergency. Remember, when it comes to appendicitis, time is of the essence. So what can you do if you or someone you know exhibits these symptoms? Well, the answer is clear. Seek immediate medical attention. Appendicitis can escalate quickly, and the sooner you get to a healthcare professional, the better. Understanding the signs and symptoms of appendicitis could quite literally save a life. So stay informed, stay vigilant. Remember, the power to prevent a potential medical emergency lies in your hands. Please like, share and subscribe and engage with us in the comment box below. Stay informed, stay vigilant until next time. Goodbye.